You want to know if your water broke? Well, you can look down. If you're standing in a puddle, maybe your water broke. But seriously, I'll tell you everything you need to know about your water breaking. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fiset. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Hi, Natalie Fiset here, a retired family doctor who delivered 3,700 babies and the creator of the Hypno-Baby.com program. So you want to know if your water broke and what it will feel like? You have to know that only 15%, about 15% of women break their water first. Most women will go in labor first. They'll have contractions. And during labor, at one point, their water will break. Or they will have their water broken artificially, like their membranes ruptured by the doctor or the midwife. Honestly, I've had many of my patients saying, well, my water never breaks. And I would smile like, never, never say never, that. And eventually I would let them and you have to know that when you're in labor, if your water's not broken, it's like a cushion of water. So it kind of cushions the contractions. The baby's head's not pushing as much on your cervix. So it's more comfortable with your water not broken. So that's one reason to hold on to your bag as much as your bag wants to hold on to you. And eventually when the water breaks, the baby's head pushes on your cervix. So it's more uncomfortable, but with the Hypno-Baby program, we can still be comfortable. But then that's why you usually dilate faster. That's why sometimes a doctor will suggest that you get your water broken. And to break the water, it's like an exam. So we just put the fingers with the glove, of course. And it's like, I'm sure you've seen those crochet when you do knitting, but with a crochet. So we slip the crochet. It's a long one because we have to reach, but we slip it between our fingers. So for the mom, she doesn't feel anything. And then we just, since the crochet has a little tip, we just break the bag. We don't touch the baby either because baby is in water. The membranes or two thin layers, it looks like a kind of a Ziploc bag. And we break both layers. We cannot differentiate the two layers. So and then the fluid comes out. If you break your water spontaneously on your own, it's most women will say they felt a pop right before, and then it's a gush. It's almost a liter of water. If you look at your milk liter, you're going to see, that's a lot of liquid. So it really gushes out. Not a good reason to sleep on garbage bags or bring your garbage bags on your sofas and everything. I'm sure you have a mattress protector. So anyways, if it happens in bed at night, which is not very frequent, but it can happen if you're dilated, because then, as you can imagine, there's more pressure. Let's say you're 4 centimeters. There's more, that's usually for a second, third baby. There's more pressure on the bag. So eventually it could break. Know for a fact that smoking women do thinner membranes. It's not a good thing. That means, you don't have as much material, you don't have as much quality material. So they do break their water more often than non-smoking women. So usually, what does the liquid look like? It's like water, the name says it, but it has sodium in it. It has salt. So it might have, it's usually clear, but it might have a little salty smell. Some of my patients said smell like popcorn, smell like ammoniac. I don't know, like pool water. I don't know. I did not find any smell when it happened. Fun fact, if the patient is in active labor and finally the water breaks and the baby's kind of low enough in the cervix, it kind of does a clog. So once the baby comes out, the shoulders comes out, then I get the rest of the wave, and I've been drenched so many times, and that's the baby's first joke on the doctor, me. So then I get all drippy, and the baby's first gag. So the other thing, the liquid is usually clear, but sometimes it could be what we call meconium, which is baby poop, which is green, and it could be like very clear green, like a jello almost, but it could be very thick, like a pea soup. And that means baby has been pooing repeatedly in the fluid. Usually there's a reason. There's a reason that usually babies don't poop until they're born. So when they poop inside the belly, most of the time it could be because they have some kind of stress. So when we see, if the water breaks and we see meconium, we pay special attention, and we check that. Well, we check every baby's, but we check that baby more, and we make sure baby does not breathe that in its lungs when it's born. When I was doing office in hot summer and humid days, many of my patients would walk in from the waiting room saying, "I broke my water, I'm all wet down there." And most often it was sweat because, you're pregnant and you're already hot because your metabolism is in high gear. So often they did not break their water. There's tests we can do. We can check with the microscope some of the fluid, and there's also like strips that we can do to check if it's amniotic fluid or not. And just also if I felt the bag, like the membranes, I knew that it was not broken. So these are all tests that, in doubt, you just call the maternity room or your midwife, and they can check you very easily. We talked about the classical, not the classical, but the obvious way of the water breaking, like a big gush. But the other thing you can have is a leak. So you can have a little tear in the membranes in the bag. And like I said, there's two layers. So sometimes the two layers will kind of not close completely, but if there was just a tear in one, so you would have what we call a high leak, which is just you're dropping. If you're not sure, if you can always do a test. You put a feminine pad. If it gets filled, it's like an unclosed tap. It's just dripping all the time. Okay, and then you put a feminine pad. It gets filled. Then, or your underwear, and then you change your underwear, and then it gets filled again. So you know that you're leaking. Again, you should call the maternity ward, and they'll tell you what to do. Once your water's broken, if you don't have contraction, they say, because what they say is you started the timer, meaning there's the baby's sterile bubble is broken, so baby is more at risk. I don't like the word risk, but it's starting to be exposed to the outside world bacteria. So they say, don't have intercourse if your water's broken and you're not in active labor, and then most women don't have intercourse when they're in active labor, and don't take a bath. When you get to the birthing center, if your water's broken and you're in labor, they'll put you in the tub, they'll put you in the pool, and same thing at the hospital, because they know you're in labor, so a baby is going to be born, so the risk of infection is very low. Of course, if you break your water and you're not term, you're before 36, 38 weeks, call the maternity ward, call the birthing center, because you need to be checked on, and sometimes they need to give you antibiotics and make the baby's lung mature, especially if you're really far from your term. So that's contact your healthcare provider, definitely. A question I got often from my patients was, especially in summer when they were hot at my in my waiting room, and then they said, "I want to go to my swimming pool, but I'm full term, and I'm afraid I would break my water in the pool and not, or in the tub, and not notice it." You can go in the pool, you can go in the tub, you can go in the shower, because your body temperature is 37 Celsius. So, and the pool water is usually colder, so it would feel like, remember when you used to pee in the neighbor's pool? So it would feel warm between your legs. Same thing in the pool, same thing in the shower. It would feel different. If you're not sure if the pool is really, really warm, again, when you got out, if you dried yourself and you changed clothes, you would feel your underwear again or your pad. So you would know like it's not a hit or miss. Okay. So don't worry about that and, clean yourself. At the end of pregnancy, baby's head is down. So sometimes another joke that baby does is just squirt your bladder like this, a little head nudge on the bladder, and then you feel gushes and you're like, oh my God, is it my water breaking or what is it? Urine is usually yellow, but if you hydrate yourself very well, it might be clear. So it's not that easy to differentiate just by the color. There's the smell. Urine smells different, but and you can just like look at it and smell your underwear. Again, if you're in doubt, just call the maternity ward. They can check. There's tests that they can do. If it was just a bladder, like baby doing a joke on you and squirting your bladder, it would stop. If it was amniotic fluid, you would still like again leak and wet your underwear. So you would know like it would keep on going unless you have a funny baby that does it all the time, which can happen. If you want more tips and tricks, I'm gonna upload a lot of videos. I had 25 years of practice, so I've heard all the questions many, many, many times. So I'm gonna answer them as they go along. Comment in the comments if you had a different water or a funny water breaking story. There's always that one. So yes, comment, subscribe, like, share. I'm going to finish by answering the big question about water breaking. But before that, if you're interested in learning how to give birth naturally, follow my program. The link is going to be in the description. It's hypno-baby.com. It's a full program, and we've had many, many beautiful births, no epidural, no nothing. So yes, definitely go to hypno-baby. The link is going to be in the description. So the last big question is, once your water break, how long will it take until the baby's out? And you know the answer. It depends. Is it your first baby? Is it your second baby? Are you having big contractions? How many centimeters are you? So nobody knows, but it's a sign that eventually you will have your baby though, because the water's broken. So there's no turning back on this point. But it could take as much as 48 hours. It could take couple of minutes, depending. If you were 9 centimeters and the water breaks, that baby's coming. So nobody knows. And go with the flow. See you on the next one.